Good morning, everyone. Today, I'm Hantistina. I will be explaining a very important topic in the field of pharmacology and healthcare: the 5 types of drugs based on their mode of action. Understanding how drugs affect the body helps us make better decisions in treatment and ensure safer medical care. These 5 types include depression drugs, stimulation drugs, irritation drugs, cytotoxic actions, and replacement drugs. Let's go through each one with clear definitions and examples. First, we have depression drugs. These drugs work by slowing down the activity of certain parts of the body, especially the central nervous system. This does not mean they cause emotional depression. Instead, they are used to calm the body, reduce anxiety, relieve pain, or help someone sleep. A good example is diazepam, which is used to treat anxiety and muscle spasms. It works by releasing the brain and nerve. These drugs are especially useful in surgeries for treating seizures or for people struggling with panic disorders. Apart from that, we have irritation drugs. These drugs cause mild inflammation or stimulation of tissues. This may sound negative, but it's actually helpful. The irritation causes the body to react in a way that solves a problem. For example, bisacodyl is a laxative that works by irritating the lining of the intestines, which then causes bowel movement. This helps relieve constipation. Another example includes topical rubs like menthol, which causes a cooling sensation on the skin. Another example includes topical rubs like menthol, which causes a cooling sensation on the skin, distracting from deeper pain underneath. Next, we have replacement drugs. These are used when the body is missing a natural substance that it needs to function properly. These drugs help replace or supplement that missing element. A well-known example is insulin, which is essential for people with diabetes. In diabetics, the body doesn't produce enough insulin, which helps control blood sugar. So, insulin injections are used as a replacement to keep blood glucose levels balanced. Other examples include thyroxine for thyroid problems or iron supplements for anemia. Other examples include tyrosine for thyroid problems or iron supplements for anemia. Next, we have stimulation drugs. These have the opposite effect. They increase the activity of certain systems in the body, often by affecting the brain or nervous system. They are used to increase alertness, energy, focus, or even heart rate. A common example we all know is caffeine. It's found in coffee, tea, and energy drinks. Caffeine stimulates the brain to keep us awake and alert. More medically, stimulants like amphetamines are used to treat ADHD. However, overuse of stimulants can lead to side effects like anxiety or insomnia. Moreover, we have cytotoxic actions. These are strong drugs that are toxic to cells, especially fast-dividing cells like cancer cells. Their main use is in chemotherapy for treating cancer. An example is cyclophosphamide. It works by damaging the DNA of cancer cells, which stops them from growing and multiplying. However, because they can also affect healthy cells, they often cause side effects like hair loss, nausea, or fatigue. Despite their risk, cytotoxic actions are often life-saving for cancer patients. To summarize, here are 5 types of drugs one more. Depression drugs slow down body activity, like diazepam. Stimulation drugs speed things up, like caffeine. Irritation drugs trigger a helpful reaction, like pisocodyl. Cytotoxic actions kill harmful cells, like cyclophosphamide. And replacement drugs restore what is missing, like insulin. Each type plays a unique and essential role in modern medicine. By understanding how they work, we can better appreciate the power and purpose behind every pill or treatment. Thank you so much for listening.